Everybody gets sad, and that's just a fact. If you're a human being, then you've definitely experienced the blues at some point in your life. However, most of the time there is a reasonable cause, such as a breakup, the death of a close friend or family member, or even a failing grade. For some people, though, these blues come out of the blue, and quite frequently. These people are experiencing clinical depression. There's no definitive cause for depression. Like most mental illnesses, there are certain risk factors that make you more prone to develop them. Risk factors for depression include a family history of depression, a personal history of other mental illnesses such as an anxiety disorder or an eating disorder, stressful scenarios, traumatic events, and alcohol abuse. Women are diagnosed more often than men. However, it has been proven that women are also more likely to seek treatment than men. Some symptoms of depression are incredibly contradicting. You can sleep all day, then not sleep for days at the same time. You can eat everything in sight one day, then get sick at even just the smell of food the next few days. Other symptoms include feeling a loss of interest in things you previously enjoyed, feeling worthless, frequent thoughts of death and dying, irritability, and of course, feeling sad. But you aren't depressed all the time. There can be periods where you feel alright and content. However, the periods of feeling hopeless typically occur more often. Depression is one of the most common mental illnesses. According to the National Institute of Mental Health, in 2015, an estimated 3 million adolescents aged 12 to 17 in the United States had at least one major depressive episode in the past year. From 2009 to 2012, the Center for Disease Control and Prevention stated that 1 out of 20 Americans 12 years of age and older reported current depression. Many people don't seek treatment for mental illnesses. This is due to the wide stigma surrounding them. When you hear somebody has depression, most people assume they are unreliable or weak. These negative connotations tend to make people afraid to get treated because they don't want to be judged or looked down on. Although it feels that way, depression is not a death sentence. It can be treated with therapy sessions and medication. Oftentimes, these medications are trial and error, meaning what may work for somebody else might not work as well for you. Taking the step and talking to your doctor and finding the right medicine and treatments for you is the best step towards feeling better.